Um, Thank you, Anjali, for introduction. As you mentioned, my name is Dr. Brevik. You call me Steve, call me Steven, whatever's comfortable, whenever you reach out, if you happen to after this. Excited to be here today to talk a little bit about ADHD and managing disruptive behavior. And so I guess what I'll probably do is share my screen and get this PowerPoint up and running. As Anjali mentioned, I have done this work for quite some time in various contexts, mostly in outpatient psychotherapy, which just means, whatever, week by week appointments, kind of typical therapy stuff. I've been in the practice, so I have a private practice downtown in Amherst where I see kids, families, adults, geriatric patients. And I've been doing that for the better part of about 3 years. Prior to that, I was at a group practice closer to Boston where I ran a lot of ADHD groups. And again, the focus is mostly on parents, kids who have kids who struggle with ADHD or other kind of behavioral dysregulation challenges. And then prior to that, I've worked Boston Public Schools and community mental health at Riverside Community Care in Boston or UInc in Worcester. And so I'm happy to kind of share some of this stuff today, hoping you guys find it useful. I mentioned this before this thing got started up that I like to have these things be a bit more interactive, and I'm certainly welcoming of that. I think Anjali, as she mentioned, is happy to take questions from people through chat so that she can kind of share them with me and stop me at any point. I'm happy to do it that way, or if people want to kind of jump in, just keep in mind that it's recorded or whatever. But so we'll get started and kind of just go through it a bit, and then maybe at the end we'll have opportunity to kind of stop the recording and do question and answer live as well, which is I think always helpful. But before we get started with anything like that, I think it's probably important to talk a little bit about confidentiality. And I think anytime you start with any kind of intervention, it's probably important to talk about. So just briefly, everything that's said in here is going to remain confidential as far as most things are concerned outside of the recording aspect of it, but I'm sure that everything can be figured out on that front. But either way, confidentiality is super important. And, we live in a small community. So, if there is opportunity to kind of go back and forth at the end of this thing, and people share intimate details about what's going on for them and their kids or their families, I just ask people to be kind of respectful of that and understand that people have, private lives. And so anything that's said in here, just keep it in here as much as you can. If you want to share, of course, your own story with whoever you want, that's up to you. But other people's stories, keep them private, keep them confidential. And then just a small note on mandated reporting. So all that means is that as a psychologist, and I would consider this a professional endeavor, anytime I'm in kind of a professional space, I'm mandated to report if I ever hear that anybody under the age of 18 or anybody over the age of 60 or anybody who's considered disabled is being abused or neglected. I've got to go report that to the proper agency. So keep that in mind that confidentiality is limited even in this context. But, I think usually this isn't an issue and it probably won't be here. But just for the purposes of saying so out loud, just make sure that we, maintain a certain amount of integrity and privacy and respect for the other families that are here. Goals for the day are pretty straightforward. I'm going to be, Anjali had asked that I, go over a, kind of set of interventions for parents who might have kids who struggle with ADHD or other kind of behavioral challenges. And so that's what we're going to do. Ideally, we'll have time either at the end or even throughout it, we can stop the recording or have the questions asked in the chat or however it is to hear from you, because I think this kind of treatment modality is best served when it's individualized, so I'm sure if you're here, you've had some issues or challenges in managing your kids' disruptive behavior, and those can be pretty unique, right? And so ideally, I'd love to hear from people and hear specific questions about what they're trying to manage. But what I'm going to go over is, a bunch of interventions that I would otherwise provide, either in group format or individual, working with a family, for kids who struggle with ADHD. So we'll go over what those things are. That's obviously the goal today. But anytime you want to chime in, that's going to be most helpful. You'll get what you put in. Okay, so I think it's probably important, to belabor this because I think probably most people know a little bit about ADHD and what it is, but I think it's probably important to just lay the foundation of what is ADHD in children and how can we understand it from the perspective of diagnostics. So ADHD is kind of it's kind of pulled down to three different categories in the DSM-5, which is this big, massive text of all the mental disorders that we diagnose now. And so ADHD is split into three categories. The first is the inattentive subtype, predominantly inattentive subtype, it's called. And that's here's the set of symptoms, and we don't have to read through them all. Kids essentially have to meet criteria for at least 6 of these, or at least 5 if over 17. Symptoms have to be present prior to the age of 12. And they're kind of straightforward. Difficulty with sustaining attention, paying close attention, getting distracted, difficulty with organizing. These kinds of symptoms, we see to some extent in the kind of normative population, but when there's enough impairment, then they meet criteria for this aspect of the diagnosis. The second subtype is called hyperactive impulsive, and so here's a set of symptoms here. Again, similarly, you have to meet a certain number of them in order to qualify for this aspect of the diagnosis. And this is the kind of more hyperactive symptoms that we think about when we think about ADHD, like fidgeting, and the inability to kind of sit in your chair, on the go, as if driven by a motor, talking excessively. These kinds of symptoms we see in a certain population, a certain subset of the population of kids who have ADHD. Often these symptoms, the more hyperactive impulsive symptoms, fall off for kids, around the adolescent period, but still the diagnosis stands. And so we see this kind of inattentive subtype, this hyperactive impulsive subtype, and then there's this third subtype, which is just combined. So they meet criteria for both of those different categorical symptom profiles. And so something that isn't listed in the DSM-5 is this other component of ADHD, which is just inherent in part of the diagnosis at this point, but it's not listed in the criteria, is emotional dysregulation or emotional impulsivity. And it's this difficulty with being able to inhibit behavior in the context of a strong emotional situation, whether it's positive or negative. So, if you're really happy or if you're really angry, being able to kind of inhibit your emotional response and be able to self-soothe physiologically and refocus your attention and organize yourself so that you can, engage in the task appropriately. And I bring that up just because I think it's something that often isn't talked about enough. I mean, ADHD is very much like a cognitive and emotional challenge for kids and adults. And so anyways, that's ADHD, right? And I would think that most of the people here know a little bit about that, but I'm happy to answer any questions about that specific part of it as well, because it's a tough diagnosis to provide as an outpatient provider. If I have a kid come in, I don't necessarily just throw a diagnosis at it. Usually we're looking at testing. We're trying to figure out, suss out, what's at the core root of some of the symptoms that they might be struggling with, because sometimes anxiety can mimic ADHD and other kind of disruptive challenges that they might have going on. So anyway, so that's ADHD. I want to talk for a moment about this idea of a developmental transactional model of ADHD, only because I think, when Anjali asked to have me come in and talk about, top 5 interventions for people who are trying to manage their kids who might struggle with this, it's a tough question to ask because so much of the work in managing ADHD in kids is process oriented. And what I mean by that is that so much of it is related to this parent-child relationship, the dyad between a parent and a child. And so this is like a nice map of how to understand ADHD and how it affects an individual and a family over the course of time. And at the core, as you can see, is this parent-child relationship. So many of these different factors affect how that relationship is impacted: parental characteristics, the co-parenting relationship, specific child characteristics like temperament, sensitivities, sibling relationships, and then there's school and community factors and societal factors. But all of this, if you kind of look at it from a bird's eye view, so much of it has to do with the system that a child is within versus just the kid themselves. Of course, there's child characteristics on this, but how it interacts with all these other elements of the system is massively important. And so much of my work when I'm working with a child who struggles with ADHD is with the parents. And there's a reason for that, having a kid come in and just trying to tell them to, shut off their video games when their parents say shut off the video game, or don't hit your sibling, doesn't work. Like having a kid come in and talk to them and play Legos with them and tell them to do that doesn't usually pan out super great. So we work with the system versus the child oftentimes, specifically when kids are younger, to try to help the systems to better equip themselves, I guess, to manage some of the challenges that come with ADHD. And so that's what we're going to be talking about today. And coming up with these interventions, again, much of them are going to be centered on how it is that you can heal and repair and best manage the parent-child relationship, and to set the stage for kids to do well while they're at home, while they're at school, out in the community, versus like, oh, here's this cool thing you can do. Say these like magic words and like everything will just be like better. It doesn't usually work like that. But I think there are some underpinning and foundational pieces to all this. So that's why I bring this up. One of the things that I think is also super important to think about is that, like, an inability to sustain attention is one thing, and hyperactivity is another, or impulsive behaviors. Those are all ADHD focused things, right? Emotions, whatever else. But one of the things that we see often is that kids who struggle with ADHD, about 30% of them will struggle with a depressive episode at some point. 50% of them will struggle with anxiety. Although I say this all the time, I've yet to meet an individual with ADHD who doesn't have some kind of anxiety challenge. Whether it's pathological or not, or enough to warrant a diagnosis is a question. Most of the time it is, because it's just hard to have ADHD and not have anxiety. But either way, but one of the most comorbid, I guess, is the classic term. One of the diagnoses that we see very, 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 very often with kids who struggle with ADHD is this. And so what ends up happening is there's all these members of the community, right? The system that we just talked about, whether it's parents or family friends or extended family or school staff or neighbors or peers, all of them kind of come down on these kids with ADHD as they're trying to struggle in like managing their day to day. They'll catch a lot of like negative narratives from these people in their life, whether it's like, you're not listening, or, why don't you just do it? Or why don't you grow up? Or you're being annoying, or you're not trying hard enough. You're bad. Stop acting like a baby. Why can't you do this? And so these kids hear this. In fact, if you know anybody who has ADHD, they'll know all about this. If they, just do it is a constant thing that they hear. Why can't you just do it? Just do it. Why can't you just do this? Just do it. Just do the thing that I'm asking you to do. Take out the garbage. That's all I'm asking. Just do it. Get rid of the cardboard. Whatever it might be. Often they hear just do it, and they really struggle with this. And over time, they hear all these narratives. And one of the things that often happens is they get very protective. There's like this psychological defensive mechanism that happens as a result of all this, where they kind of think like, oh, geez, I can either believe that I'm actually bad, or I can say I'm not bad. All of you are. So parents, family friends, extended family, school staff, neighbors, peers, you name it, all of them. Instead of like believing them, they're going to kind of cancel all of them out, and they become irritable, they become resentful, they become vindictive, and they develop something called oppositional defiant disorder. And the reason I bring this up is because I think it's really important when we're talking about managing ADHD that we're talking about, inattention, hyperactivity, impulsivity, or defiance. And we often see oppositional defiant disorder as comorbid with ADHD. In fact, I mentioned 30% will struggle with depression, 50% will struggle with anxiety, but upwards of 80 to 85% of kids who have ADHD will also catch a diagnosis of oppositional defiant disorder. I've mentioned before when I've presented with NAP in the past, and I say this often to parents, I stopped diagnosing it. I stopped even putting it down. You can have oppositional defiant disorder without having ADHD. That can happen, and happens with some depressive patients or different things that happen, but often it's comorbid with ADHD. And it's a question for me as to whether or not it's even its own diagnostic thing. Like, what's the point? What's the point of diagnosing it if it's 85% comorbid with ADHD? It doesn't really make any sense. Anyways, this is characterized by losing temper, touchy, easily annoyed, angry, resentful, argues with authority figures, defying to comply, deliberately annoying people, blaming others for their mistakes, spiteful or vindictive, which you see a little bit less of, but it's still there for some. And so I think it's important to know, like, what is it we're trying to work through here? Because if it is more defiance or compliance oriented, it's a separate intervention that we would employ versus if it's like, a challenge with like a cognitive skill, like sustaining attention or managing one's hyperactivity or impulsivity. In each of these instances, we're kind of using different interventions or different behavioral interventions to try to reduce whatever it is that's kind of causing a kid disruption, school or home. And so I bring that forward for that reason, but also for the purposes of understanding how it is that this can kind of wear on a parent-child dyad, or the relationship between a parent or a caregiver and a child. Parenting is tough anyways, but parenting kids with ADHD is particularly challenging. The research shows that substance use and abuse is increased for parents who have kids who are diagnosed with ADHD. There's greater marital conflict and divorce, higher rates of depression in parents of kids who have ADHD. This is, it's a challenge. And when I'm working with parents and with systems who are trying to care for kids who struggle with ADHD, we're often talking about how these parents can best manage some of these things, and it's a stressful endeavor. And so it's really hard not to go into this with some message of like, you guys are going to have to take care of yourselves, and nobody wants to hear it. Nobody wants to hear like, oh, here's all these self-care strategies that you can employ in order to best manage this, but they're like massively important. So we tend to like skip through this step often. When I'm giving my when I'm like conducting a group of, for parents, like early on, there'll be a slide that says like, you're going to have to remain well regulated while you do all these interventions. And then we get into the interventions, and inevitably someone's like, can we go back to the slide about being well regulated? Because how do I do that part? Because the kids are bananas and they're taking acorns from the playground and they're like chucking them at other parents or something. Like, it's hard not to explode. And so I think it would be foolish for me not to at least make note of the fact that you're probably here because this is hard. And if this is hard, I'm just going to take it on faith that you guys are doing all of these things already. If you're not, think long and hard about that, because this is like a massively important part of parenting children who have ADHD. Self-care is an annoying word. Nobody likes to hear it. Maybe some people like it, but most of the time it's kind of triggering and annoying. But it's super important. Mindfulness, these are what I call the big, it's like the big four, the physiological interventions that everyone should be doing in order to maintain some balance of emotional regulation. And parents right now are just slammed with stuff, and nobody has time for anything, and everybody's exhausted. And parents who have kids with ADHD, even more so. So like mindfulness, relaxation techniques, it's hard to get into a pattern of doing these things, but it's huge. Diet, nutrition, try to eat well, try to take care of yourself. Don't drink a lot. Don't smoke a lot of weed. Try to take care of yourself, nutritionally. Exercise. People should be exercising often if they can, 3 to 4 times per week. 30 minutes of aerobic activity, you'd be amazed at what it could do for you in terms of your stress management. And then sleep. A bunch of kids with ADHD struggle with sleep. It's like part of it. It's well known, well documented. And so like getting sleep as parents is hard enough. Getting sleep as a parent of a child with ADHD is even harder. But we try to do what we can to help kind of set the foundation for you guys to be successful. And this is going to be a huge part of it. And I know you didn't come here to hear me say all this, but it's huge. In fact, it's pretty well documented that ADHD is a highly genetic disorder, in that 50% of kids with ADHD have a parent that has ADHD. I think that's underrepresented in almost every example of families that I've worked with where the kid struggles with ADHD. I'm like looking at the mom or the dad and just go like, which one of you guys has it? It's very common that it runs in the family. It's more heritable than height, they like to say. And so if we think about kids with ADHD and their struggles, and then a parent who might also have ADHD, Russ Barkley, who I'll reference regularly in this presentation, is a major researcher in this field, talks often about how it's just like loggerheads. like, just kind of bumping heads, and then there's constant conflict, the parent with ADHD and the child with ADHD. Sometimes it's actually goes better than that, but often that's the case because there's this rigidness and emotional impulsivity for both the child and the parent. And some recommendations around physical exercise for people with ADHD are 5 to 7 days per week of 45-minute periods of intense aerobic exercise is the recommendation for some people with ADHD. Now, that's a lot, man. 5 to 7 days per week of 45 minutes. Anyways, I'm not trying to beat a dead horse here. Just take care of yourselves. And I'll just take it on faith that that's what you're going to do in order to remain well regulated while you do some of these interventions. And so, if you want to, step one, it's probably the best place to start. And so we'll get into this. Yeah.
Sorry to interrupt. There is a question. So this person is asking, so the first question is, if they suspect their child may have a mood disorder, what is the best way to approach looking into whether that is the case, other than checking in with the PCP or having like another neuropsych evaluation? Are there any other resources, things that you would suggest?
So, and they said specifically learning disorder, Anjali?
They said mood disorder. I'm sorry.
Mood disorder. Okay. Yeah, I mean, the best way to probably suss that out if it wasn't found through neuropsych evaluation, which sometimes it wouldn't be. So for those that aren't aware, what a neuropsych evaluation is you go and meet with a neuropsychologist. Usually the parents would meet with them for an hour and go over what the kind of presenting issues might be for a child. And then the kid goes in and does this period of testing. It's usually about 6 hours in length. Often, because it's kids, it's broken up a bit, either in 3 different sessions of 2 hours, or maybe it's a full day, 3 hours, and there's a break, and then 3 hours. And during that testing period, there's a whole bunch of different assessments that are thrown at the kid. IQs are often, an IQ assessment, which is usually like something called a WISC, which is like a standard IQ test. But then a bunch of other battery of tests is going to get thrown at them. And when they're talking about mood disorder specifically, all they're doing is basically looking at the parent's report, as well as like some checklist kind of stuff. So they'll give the parents like some checklists to fill out. They'll give the kid like a self-report measure sometimes, which will be like, how sad are you? And so, it's not uncommon for people to not, I wouldn't say falsify information, but on self-report measures, there's always a little question as to whether or not someone's going to be overly honest or overly intensely kind of bombastic in the reporting, which is like a call for help. And so, neuropsych, although they're great for looking at intellectual deficits or executive functioning deficits or different kind of cognitive skills and weaknesses, mood disorders are probably best diagnosed and understood and treated with the help of an outpatient provider. Like, go to a therapist, right, and talk with them, and have the kid talk with them, and look at the sets of symptoms and see if it kind of meets criteria or not. And so that would be my answer. You could talk to, of course, your PCP, but that's limited, and it might not be quite enough. And also, if you're suspecting that your kid struggles with a mood disorder of any kind, you're probably going to be best served in treating it through psychosocial interventions. So when I say it's not really helpful to work with a kid who has ADHD by telling them, hey, stop hitting your sibling, or turn off the video games when mom says so. That's true for ADHD. However, if they're struggling with depressive symptoms or anxiety challenges, meeting with a kid one-on-one can actually be pretty helpful, right? Like, mental health treatment does help. So I would suggest, try to find an individual provider for the kid. Hopefully that answers.
Okay, thank you. And their other question is, are you taking new clients right now?
I know that probably sounds like a crappy thing to say. Anyone at the end of this thing can reach out to me. I'm very passionate about mental health care access. It bothers me the way that the system is currently constructed, and anyone that I ever meet or bump into, and they're like, "Oh, what do you do?" I'm like, "Oh, I'm a psychologist." They're like, "Are you taking patients?" I'm full currently, but I keep a very small wait list, and I'm happy. Anyone at the end of this thing, I'll share my email address, my phone number, whatever. Feel free to reach out. Even if I can't help you right now, I can help you through email. I can help you through phone calls. I can help you until I can take you on. I'm happy to do that. So I'm not going to leave people high and dry.
Thank you.
But as of right now, things are very tight in the practice. But that's just for now. That always changes often. Okay, we good? Yes. Okay. So interventions. I don't know if people came prepared or not to do this, but one of my favorite ones, from all this work that I've done, is this exercise that Barkley came up with. And he calls it the supervisor exercise or the manager exercise. And usually I pass out a piece of just kind of plain white paper and have people fold it in half. And on one side do something, on the other side do another. So if people have a piece of paper and they want to do this, by all means. If you want to use your cell phone, and like just do it that way, just kind of like break it up into two different chunks on a notepad or something, you can do it that way. But I'm going to encourage people to do this because it's kind of illuminating. So on the left side, what I'll typically have people do is I'll, give all of you guys like a minute to imagine a most disliked authority figure, whoever that might be in your life history. It could be a boss, teacher, uncle, I don't know, anyone that you can think of that was in a position of authority over you, that was like kind of regularly, working with you to manage whatever you had going on. Try to have a real person in mind, not someone fake, and list 5 traits that describe them. And so I'll give people like, I don't know, maybe it'll be 30 seconds. I don't want to waste too much time on it, but just try to see if you can do that. Cool. Okay. And then I have people do on the right side now, imagine, your most cherished authority figure, whoever that might be. Similarly, boss, teacher, clergyman, whoever, somebody that might be in your memory as someone who was cherished in your mind. And then 5 traits that describe them. Okay. I'm sure all of you can kind of see where this is going. As you look at these different, these 5 traits, what I would typically do in a group is we would, kind of open it up to folks. They could say a little bit about some of these people from their history and how it is that these different traits affected them as they worked underneath these different people. Usually people, we'll talk about a boss or manager or supervisor, someone, who was just really rough on them and someone who was really supportive. And so some of these traits that we're going to pull from as we talk about, as we would talk about this in a group session, we'd really think about like, how was it that, your level of motivation was affected, by this person and the quality of your work? How was that impacted by this person? What kind of things and attributes, different traits that they discussed over the course of your work with them, how did it affect basically your motivation and quality, the work that you had underneath these people? And as you look at these 2 different lists of character traits, I want you to just ask yourself whether or not your child would label, one list or the other as, like their feelings about you and your relationship with them. Often we see, in the most disliked category, things like controlling or manipulative or, punishing or consequence driven or whatever else. And on the other side, you might see things like supportive, understanding, empathic, caring. And so, often, I guess, obviously the goal in this is to try to show people that, like, everything happens in the context of a relationship, and many of the things that we're going to be working on in terms of managing disruptive behavior in the moment is going to be better served if you have that, the list of traits in the second category, where you're supportive, you have all things already in place, so that when you're intervening in the moment, you're understood from a different perspective, from a different lens. And so much of the work that we do with kids who struggle with ADHD or any kind of oppositional behavior at all is in line with this. It's this idea of like building the relationship between you and your child, so that you can engage with them when it comes time. It's like doing the work ahead of time, so that in the moment goes a bit better. And one of the ways that we do this is we encourage one-on-one time. This also is not going to help you in the moment when you're at the playground, when the kid's taking acorns and chucking them at the nearest 3-year-old toddler. However, again, it's going to be easier for you to engage with them and interact with them and guide them if you have a good relationship with them prior to. And so one of the things we talk about is positive to negative interactions within a relationship. And they've done all kinds of research on how it is that positive to negative interactions impact relationships in positive and negative ways. And what they've come up with, how they came up with this, I'm not entirely sure, is that it's there's a 5-to-1 ratio. So we want to have 5 positive interactions to negate or balance out 1 negative interaction. And often when people are coming in here and they're talking to me about the disruptive behavior that the kids have, the negative interactions greatly outweigh the positive ones. And so one of the things we try to employ is this idea of special one-on-one time. And in almost every ADHD manual or book on managing disruptive behavior will have some chapter on one-on-one time. How they define it, how they put boundaries on it is going to change, from different module to different module or whatever. But most of them are going to have some carved out time where there's no distractions, there's no phones, there's no emails, there's no arguments, there's no nothing. It's just one-on-one time where you can really kind of bond with your kid. I tend to teach these pride skills. This was developed by Sheila Iberg and the PCIT model, which is a parent-child interaction therapy. It's a specific therapeutic intervention that you can offer. And she came up with these pride skills, and there's the PRIDE, right? Praise, reflect, imitate, describe, enjoy. You can Google these, and you could be able to find different ways to engage your kid in it. But essentially, you're just carving out 15 minutes a day, where you can. And 15 minutes seems like a short amount because it is. They do that on purpose. Because anybody who says geez, I can't find 15 minutes, maybe there's a little bit more of a clinical issue there. The idea of 15 minutes a day should be manageable for everybody. I understand that everyone's kind of tight on time, but being able to kind of sit there with your kid and just do some activity where you can set the stage for you to just be there with them and praise them often, reflect back what they say so they know that you're hearing you, imitate them if they're doing something goofy, do it back so they know that you're watching them, describe what they're doing. And it's a little bit awkward for some parents, but find some way to be genuine and enjoy it and be enthusiastic about it. And you'll find very quickly that kids just gobble this up. When you get to be a little bit older, some of the preteen adolescent folks, they don't gobble this up, but deep down they're gobbling it. So one of the things I wanted to make sure that we mentioned today was make sure that you're carving out some time for positive interactions. I know it's not why you're here, but it's probably important. So consider that one of the interventions that we'll employ. Another one is going to be related to behaviorism. And so most of the time when I get a question about, hey, I've got this one behavior that my kid struggles with, oh, here's something that happened this week. What should I do? How should I manage this? One of the things we try to teach within the context of this work is behaviorism. Behaviorism is just this idea that, anytime we see a behavior, there's something that either reinforces it or punishes it, which means essentially that whatever happens after the behavior or the consequence of the behavior will either cause the behavior to increase or decrease over time. That's all that this is. So we talk about this from the perspective of ABC, antecedent, behavior, consequence. Antecedent is the before the behavior. Then there's the behavior itself, and then there's the consequence of the after the behavior. And what we try to focus on with parents is before and after. The behavior itself is actually less important. We can't really handle that. It's not really the thing that we're working on. We're working on the things both before and after. And so if we can set the stage to have the behavior that we're looking to decrease over time by setting the antecedent up a certain way, that can help. Or we can work on it on the after effects. And so I'll give an example of this, and we'll talk a little bit about it. But essentially, that's what we're looking for. That's what we're looking to work on. It's like, how do we reinforce or punish certain behaviors such that they decrease over time? And in order to think about this, we think about the three major drivers of reinforcement in humans, and it's attention, access, and avoidance. And I think those are really important to remember. So if you guys want to jot those down, those are really important. The reason why we do most things is because of these three: attention, access, or avoidance. Attention, like I want positive or negative attention from somebody, or I want access to like my video games or that chocolate chip cookie that's sitting there, or money, or whatever. And then avoidance, like I don't want to do that thing, so it's going to drive me to leave school, even though I shouldn't. I'm going to do that because I don't want to have to deal with it anymore. Or I'm going to do this to avoid X, Y, or Z. So these are the three biggest agents of reinforcement. And I teach parents this because it's super important for you to understand what is it your child is trying to get. Like, what are they trying to get out of whatever it is that they're doing? You know, if we think about the kid chucking acorns at the toddlers at the playground, like, what is it that they're trying to get out of that? Is it attention? Are they trying to build some kind of relationship with this kid? Are they just trying to have fun? Like, what is it that they're trying to accomplish? If a kid's getting into an argument with you about, I don't know, bedtime, like, what is that about? In each instance, there are some driver of reinforcement. In other words, anytime they're doing this thing, something is reinforcing it, which means that the behavior is more likely to happen again in the future. And so we teach people this because I think it's super important to understand this idea of two paths to a reward. Oftentimes, like whatever the antecedent might be, there's this behavior that kids might engage in, and then there's some kind of consequence as a result. And what most parents want to do is to take away the reinforcer. So in other words, like, a good example. A good example might be like if a kid's screaming for a cookie, right? Like, I really want a cookie, like I really want a cookie, right? You have this, they've walked into the kitchen, they see that there's a jar of cookies up there, and they scream at you, and there's the behavior to get the cookie. Now, you could just cave and give them a cookie, which would then reinforce this behavior where they walk into the kitchen, they scream for what they want, and then they get the cookie. Well, most parents would suggest, hold up, if you're going to come in here and scream for the cookie, you get nothing. And so we take away the cookie, right? Like we just say, no, nada, sorry, kid, you're out of luck. So we tend to like take away the reinforcement for it as a means of managing the behavior. What I'm suggesting to you is that you're better off cutting off the behavior and giving a better pathway for them to get whatever the reinforcement might be. So in other words, if they want to, I don't know, have a cookie, they could come in there and ask politely. They could ask when it's an appropriate time of day. They could ask after they've had a meal. They could have like a nice conversation with you about like nutrition and whatever else. I mean, you could apply this to really any behavioral pattern that you're seeing. In the end, there's going to be times where you're going to say, sorry, kid, no cookie. It's like 6:30 in the morning and I'm not going to give you a cookie right now. There's definitely going to be times where you're going to be laying a limit around like what it is that, you know, you do or do not want them to do. But in the end, I think most of the more challenging ones that come up, I just had one come up the other day where, you know, this 4-year-old or 5-year-old struggles with their younger sibling who's, coming out of the middle of the toddler years, 2.5 or something. And, you know, this 2.5-year-old would go up and grab a toy. It would happen to be the older kid's toy. And so the older kid would go over, whack the younger sibling and get their toy back. Now that aggression works, right? It gets their toy back. Is there instead of saying, okay, now you have to go to your room, do a timeout or whatever else, instead of doing that, it's much more helpful for a kid to teach them what's the right way of going about getting whatever it is that you're trying to accomplish here. If you're looking to get your, I don't know, toy plane back, you know, instead of going over and whacking your younger sibling, I can't let you do that. I'm not going to let you hurt them. Instead, let's think a little bit about teaching the skill set that's required so that these kids can like accomplish what it is that they're trying to accomplish the right way. And so that's ultimately like, what we're trying to get at most of the time whenever we're working with kids who struggle with it. Some kids will fight with parents just to avoid having to do homework. Some kids will get into arguments or deliberately defy adults in their lives for attention. We have to kind of suss out what it is that they're, trying to get for reinforcement, and then trying to figure out how they can get that the right way. And so, it's not exactly, again, like it's not something I can just like open up a drawer and give someone a tool of like, hey, do this. It's much more so a process of building a relationship with your kid and managing how it is that you can teach them the right way to go about getting what they need to get in this world, which is parenting, right? It's just harder when they have ADHD because this kind of stuff pops up a lot more often. I'll shift over as well to this other one, which I think is important. And then, we'll see what kind of, questions come up and different stuff that might come up for folks. And there's a bunch of other ones I can get into. But this one's kind of big. This comes from the work of Dr. Ross Greene, for those that might know it. He wrote a little book called The Explosive Child, which is a tough recommendation to give to parents. Like, imagine being like, hey, I've got this book that I want you to read. It's called The Explosive Child. As a parent, like if I got that book recommendation, I'd be like, what the heck, man? But it's a great book, and Dr. Greene, he's a local guy. He's, I think he's at MGH or something. He's like a Harvard fella, and he gives talks in Wellesley or something quite frequently, or from what I've been hearing, anyways. That's his neck of the woods. And so you can go see him talk, and he's world renowned. He's a hot shot, and he created this idea of a collaborative problem solving approach. And I like to teach this one to parents because this is the one you're going to use as your kids get older. This is the one, unlike some of the other interventions that we would employ for ages 4 to 11, as kids like surpass that and get into like 12 to 17, 12 to 18 years old, like this is the one you're going to be working with a little bit more often. So the collaborative problem solving approach holds this premise that kids do well if they can, that all kids are trying to do well. And truth be told, I've never met one, never, that was like, yeah, I'm really trying to screw this up. I'm really trying to just bombshell everything. Like, they don't want to do that. They all want to be good kids. They all want to perform well. They all want their parents to like admire and love them to the moon and back. I promise. Every single one. So it holds this premise that like, if we could give the kids the right scaffolding, they would all do well. And it also focuses on this other element that's super important of being proactive versus reactive. What I mean by that is like, instead of dealing with it in the moment, you're doing it ahead of time or outside of the instances when things are really explosive. So if you're having a fight around bedtime every single night, that's probably not the right time to manage what's going on. Like, we might want to do it when things are more calm. And we're problem solving together with our kids versus doing, other ways of managing it. Basically, Dr. Greene talks about how skills deficits, and I'll fly through these in a second, skills deficits coupled with demands of the environment yield a problem for a kid. And then they try to solve it. And sometimes their solutions aren't that great. So when he's talking about skills deficits, he's talking about these ones. He goes through 5 different areas of cognitive, and he calls them, they're largely learning disorders. If we're going to think about it from this perspective, like they are areas of relative weakness that a kid might struggle with. And they might struggle with one, they might struggle with all 5. Emotion regulation is one, the ability to use logic and reason in the moment, on top of emotion, right? So to be able to make like this decision that kind of combines both emotion and logic. Executive functioning, which I'm sure many of you have are somewhat privy to. It's like kind of buzzy. It's got a bunch of different kind of supportive cognitive features of our intelligence and our processing that include things like initiation, or the ability to start things, or planning, or organizing, or shifting cognitive set, or working memory. It's basically the ability to conceptualize and execute on a task. Which has very little to do with intelligence per se, but more so just being able to execute on things, be successful. The next is social skills, the ability to take perspective or understand nonverbal communication. Cognitive flexibility, how to get into this. The ability to, like, when you have something in your mind, be able to be flexible to it. Good example might be like a kid planning, heading home in the car with mom, is supposed to log on, play Fortnite with their friends at 3 o'clock. And if it's like 3:05, they're just losing their mind. Because they just are like, I had it in my mind that I was supposed to log on at 3 o'clock. It's like rigid idea that, like, now I've missed it. You haven't missed it. That's a bit distorted. It's 3:05. Like, we're going to be home in a minute. That kind of idea. So this idea of cognitive flexibility, this is another area of relative weakness for some of these kids. Or language, expressive and receptive language. The idea of problem solving as a language-based process. Like, for example, I often talk about, like, how if I'm going to make a chicken parm, I'm like, okay, and this is in my head. How much chicken do I have? Let me pop open the fridge. Okay, I got this chicken. All right, do I have breadcrumbs? Hold on, let me check. And I'm going to open up, and there are the breadcrumbs. Cool. I need eggs. Got eggs. Here they are. So you're like problem solving in your mind as you're going through this process. And that's, of course, internally. Expressive and receptive language is also an area of relative strength or weakness, depending on who we're talking about. And in the context of all these different demands of the environment, if someone's got an expressive or receptive language challenge, they're going to be a little bit more tasked with coming up with solving problems, and how that's going to go might kind of vary person to person. So what Dr. Green talks about is these different skill deficits coupled with demands on the environment lead to these different issues, these problems that kids are up against. For example, if you might have, I don't know, let's say a kid who struggles with executive functioning challenges, and they have this paper that they're supposed to write. They've been procrastinating on it, and now it's due tomorrow. And they're really anxious about it. And they're like, oh my God, like, how am I going to get this thing written? And they don't want to talk to their parents about it because they're nervous about what the reaction is going to be. So they solve this problem by saying, I'm just going to throw up in the toilet. If I just go in the bathroom and I throw up, I don't have to go to school tomorrow. And then I don't have to throw my paper. Problem solved. Obviously not the best solution to that problem. And so what we try to do in these various circumstances and using this intervention strategy is come up with some way to help a kid to solve the problem a little bit of a better way. So what Dr. Green explores is that there's like these 3 different ways that we tend to manage these problems with our kids as adults. He talks about plan A, which is like, I guess to remember it, it's plan adult. It's when you oppose your adult will unilaterally. It means that, like, when you set the limit, like no means no, like, and then, the more that they challenge that, the more you come down with the hammers, like, you have to listen to me. This is my decision. That's how it's going to go. That has a tendency to kind of rip and tear at the relationship between you and your child. And we talked about how that can be impairing for a variety of reasons. And then there's plan C to go on the other side, which is, if you need to remember it, it's plan child. It's when we kind of like accommodate or drop an expectation temporarily. So if the kid comes in the kitchen and screams they want a cookie, we give it to them. This idea of like just kind of dropping it, just being like, sure, we're going to accommodate the kid here. Dr. Green talks about how this is stabilizing for the family unit. And so it's not always a bad idea to use plan C, but ideally we're using plan D, where we collaborate and we problem solve and we work together. So how is it that we use plan D? Well, he goes over it, and it's like a 1, 2, 3-step process. The first of which is empathy. So empathy is this idea, right, where we feel genuinely, try to understand and share the other person's experiences and emotions in the moment. Being able to kind of crawl into their skin, understand where they're coming from. Empathy is really hard. It's like something that, like, you need to, like, work on as a skill. Often we're stuck in our own perspective. We have our own emotional interference that kind of gets in the way for us to be able to understand other people and how they're doing and what's going on for them. But it's hugely important in terms of, like, managing kids, empathizing. So we're really trying to get down to it. Like, what's going on for you where this is happening? Not only is empathy helpful for understanding what's going on for a kid, but it promotes emotional regulation. So ideally, it helps them kind of like de-escalate generally. Dr. Green loves using the language, what's up, because he's hip and he's cool. So what's up? You kind of ask your kids, hey, what's up? What's up with this? Like, I've noticed that this happens every night. What's up? However you use the language is fine. I think it's really important to focus on how you frame it, because you really want to be curious and non-judgmental, which is tough to do, because most of the time when we're pointing out something, it seems like we're being judgmental or accusatory or something like that. And it's not supposed to be like that. It's just kind of like, hey, I've noticed that when this is going on, this is how you respond to it. What's going on there? Like, what's happening for you? Like, tell me a little bit about what's happening for you. And if we can really get a kid to soften, then they'll tell us what's going on. And sometimes it's like not what we think, you know, it's just not, it's like totally out of left field. You're like, oh my God, I never would have guessed that that's what's actually going on for you. I thought that was something entirely different. And so like, first step, understanding what's going on from a child's perspective. Second step is defining how it's a little bit of a problem from your perspective for them to handle it the way they are. No, this isn't right. I don't have the right slide here. So what I mean by that is, like, you might say something along the lines of, okay, I've noticed that this is what's going on for you. And it's really, maybe they'll tell you, I don't want to go to school tomorrow. I'm not going to school tomorrow, or whatever else. You go, hey, what's going on here? It seems like every Sunday night you're talking about how you're not going to go to school tomorrow. But they're like, well, yeah, you know, because whatever. I've got this like kid in my gym class and he's super mean to me, and that's why I don't want to go. And you're like, oh man, I didn't realize that. Okay. You might say something along the lines of, so I understand. It makes perfect sense. Every Monday you have to go to gym class, and there's this kid in the class who's treating you really poorly, and it makes you feel awful. And so that's why it is you don't want to go to school on Monday. So that makes sense. Here's the thing, though. I'm your parent, and I can't let you skip school every Monday. You know, I'll get in trouble, and it's the law. You got to go to school. So I think we got to come up with a different solution. And this is when you invite the kid to solve the problem. Of course, this process promotes problem-solving strategies through language, which is great. And it gives this kid an opportunity to understand that their problem is bigger than just theirs. There's like a society that we live within, and that they have to kind of like work together with other people to solve their problems, which is fantastic. The issue is that most parents go into this step with this idea that, like, okay, I want it to be solved my way. You can't do that. You got to go into it with this like kind of soft approach of like, I'm going to work with you until we come up with your solution that works for both of us, however that works out. And it can be like a patient, long-term process to figure this out. In the example that I just gave versus the one that's on the slide, you know, maybe the kid comes up with this other one where they suggest like, well, what if I go to school tomorrow and instead of going to gym, I go talk to my guidance counselor and tell them what's going on. It's like, well, that's a mint idea. I love that idea. Like, that sounds great. That not only solves my problem where you're actually going to school and solves your problem, but it also solves this other problem of like how we get this kid to stop treating you this way. So this collaborative problem-solving approach of this 1, 2, 3, you know, stepwise process of managing solving these problems allows you to kind of build a relationship with your kid, understand what's going on for them, help promote this great process, and it's phenomenal, but it takes a long time to kind of build and work our way there. So again, this isn't like a, hey, say these 5 magic words and you should be good, like you'll solve all your problems with your kids. But it's something that, like, if you start working on this early and often, you'll get to a place as they grow and they develop into their adolescence where you're able to have like a little bit more of a back and forth and a positive, you know, relationship as you're managing all these different issues that are going to crop up.
Dr. Brevik, I have a question. It's actually one of my questions. So going back to when you were talking about teaching like an alternative reaction, right? Or a way to kind of solve a problem, like with little kids hitting, and you try to show them like, okay, instead of hitting, like, what could you do instead? How long does that take for a child to learn on average? Like, how many times do you kind of have to repeat that, right, for a child, especially with ADHD?
Sure.
I don't know.
Yeah. So that's, I mean, it's obviously going to vary, right? It's going to vary wildly. You know, some kids, depending on their age, their areas of relative strength and weakness, where they are in their developmental trajectory, how that sibling relationship is going, how it is that we respond. The one thing I think that is important to think a little bit about is that with that one in particular, Anjali, like, you know, if we think about behaviorism, one of the things I try to teach is there's these different schedules of reinforcement, right? And the one that is the most reinforcing is this variable schedule of reinforcement, which is why like slot machines get so many people. So, for example, if we're going to use like a good one that I often hear is like teaching kids how to say "excuse me" to parents before they like come up to them and just like scream "mom" at their face, like if they're on the phone, right? So if you're like on the phone, you're like talking or whatever, you kick them, like you're just like what is it? What is it? If we reinforce that behavior instead of like encouraging, hey, I'd love to answer you right now, but I'm on the phone, and as soon as I'm done, I would love to talk with you about whatever it is you need. Also, please say "excuse me," and then you go back to your thing. In that instance, you're using an active ignoring skill, where like you're promoting this behavior instead, right? The two paths for reward is what you're referring to. If we reinforce that mom, let's just say like, and you're like, what is it? What you go? Yeah, just go. And we're like reinforcing that behavior every so often. It's kind of like a slot machine, like when you hit that slot machine, you hit the jackpot once every, I don't know, 15, 20 times. Like you're going to be so much more likely to keep pulling on that lever, I don't know, slot machine lever, because it's variably, reinforced at the schedule that makes it seem like, hey, maybe this time, which is why you see sometimes these kids, they come at you with like, hey, can I stay up late tonight? You're like, no. And then the next night, hey, can I stay up late tonight? Like, no. Hey, can I stay up late tonight? Because one of these times, maybe the 15th time, you're like, fine. And kids say they're getting really good now and figuring out like, okay, dad's tired. He's really tired. We had a long weekend. I can tell he's really frustrated. I bet if I come at him now, and like it's not like they're like twisting their mustache, like thinking about how manipulative they can be, which is the word I hear all the time, which is like a nasty word, right? Manipulative. We're all manipulative. Every one of you is manipulative. Okay, everyone's manipulative, and your kids are too, because that's what we do. We manipulate the world around us to get our needs, right? Anyways, so if we think about it from that perspective, we control for the things we can control, and we allow the cognitive skills and the developmental process to take shape and form over time. Then we can't really think about like how many trials it's going to take to help a kid learn this. We instead think of it as like as long as it takes, as long as
we have to just be consistent.
I think consistency is the only thing that is within your power and control. Is like, how can we manage this? Like over time, best case scenario, it's just through consistency, love, support, guidance, and all those positive things. Does that make sense?
Right. Thank you.
So I've got a whole bunch of other interventions listed here, that we also go over in these group formats. And so, like many of these, we, have full sessions on and talk about. But, another really important thing to consider is like when we treat ADHD in kids, just sometimes it's not enough to just do psychosocial interventions. Sometimes you need stimulant or non-stimulant medications, executive function skills training, social skills training, family therapy or individual therapy to help suss out different things that kind of pop up. But I want to make sure that I leave enough time. I don't know, Anjali, if this seems like a good time to hit the brakes and see if people want to kind of go back and forth a little bit.
Yeah, I don't see any new questions in the chat, but we can definitely have people ask if they're comfortable, like directly.
Yeah, and I'm happy to kind of keep going until 5:30 and just kind of bounce off a whole bunch of other stuff just from the hip, if that would be helpful for folks. So we can kind of like open it up to people and see if they want to.
Yeah, sure. You can open it up.
However people want to. We'll do this.
Someone just said, how do we approach support for kids who get activated by another classmate in school?
Can you read that one more time for me?
Yes. How do we approach support for kids who get activated by another classmate in school?
Yeah.
Maybe like dysregulated.
I'm just like, how do we approach support? Well, like obviously from like in looking at the different levels of the systems involved, like we probably want to be working with, the school and the teachers and, you know, the adjustment counselors or the guidance staff around something like this, because first of all, activates can mean a lot of different things, but I think I know what they're saying because many of the kids that I've worked with will have this challenge. There'll be another kid in their class, either that's like just really annoying to the patient or to the kid I'm working with. And if that's the case, like it's pretty tough. It's here, and it depends on a lot of different things. One of the things I often see is that there's like a little bit of like a challenge with, you know, regulating attention for the child, in that they'll get kind of hyper fixated on one kid in the class and what it is that they do or say or how it is that they respond through interactions. In those instances, like if we think about it from the perspective of, let's say, the collaborative problem solving approach, there's some skills deficit on the part of the child and the demands of the environment. Maybe that kid in the class is really annoying, and how it is that we can teach those skills and come up with a solution with the child to figure out how they best want to manage this. But in some cases, and I see this all the time, it's often better to just split those kids up, you know, just split them up. So there's some cases where the system can accommodate that, some cases where the system cannot accommodate that. If we're talking about like a bullying situation, and that's the kind of activation we're talking about, you know, obviously, like there a lot of supervision, work with the school around like how it is that they can like best manage those kinds of situations. And at times, like if there's a like true to form bullying situation, there needs to be some kind of consequences for the bully. So it can really depend. But if we're gonna from the parent perspective, which is what I think this person is asking, working with your kid to be able to communicate how it is that they feel and being able to kind of like look at how these different areas of skills deficits combine with the demands of the environment, how they can come up with a solution that is both, you know, going to work for them as well as other folks, is probably the best way to do it, you know. So just through communication, right, through support of your kid, and just let them know that they're the greatest thing since sliced bread, and what are the different facets and maybe some of the different skills areas that might be lagging that would help them to overcome that. Unfortunately, and we all know this like way too well, there are just sometimes like annoying people that we're just going to have to deal with.
They added they both have challenges with impulsiveness, and so they ping pong off each other, get dysregulated easily, making the class environment difficult, and are getting lots of negative attention.
Yeah, so I mean, like neither one of those kids are going to be able to handle that. That's like a system thing, right? So you got to work with the teachers, work with the staff, kind of like brainstorm, come up with some ideas, see what works. Oftentimes, like redirection and getting kids to, you know, just separate is best. And there are times where schools and districts will literally place kids in different classrooms on purpose going forward, just for that reason, to avoid disruption of the class, but also to like, you know. And so there's a good example of like an antecedent answer, you know, like if you put those two kids in the same classroom, you're setting the stage for this behavioral process to unfold. Can we address things on the antecedent side of things in order to best manage stuff?
Nadine, you have your hand up. Did you want to ask your question?
Yeah. Hi, Steve. So if talking about not from like the parenting perspective, but students or working with like your kids' peers, what are the tools in these lists that work best for?
Nadine, we lost you. It got muted.
Kids who have trouble transitioning, they get fixated on tasks. How do you help them move to the next thing if it's urgent without stressing them out? Can you like go over any of those like tools that would be helpful in those moments?
Yeah. I mean, whenever we're talking about like transition stuff, it's best, like most things, it's best addressed before it happens, you know. Right. And this is why we always give so many kids like transition warnings, or, you know, kind of setting the stage for them to understand what's going to happen. The issue most of the time with those things is that kids don't care, you know. So like when they're in the middle of something and you're like, hey, 5 minutes, they're like, they might not even hear you, and then I'm going to get encoded, you know. If they have if you have their attention, you have their eye contact, and you're knowing that they're hearing you say, here's this thing that we're going to be doing in 5 minutes or whatever else, and like laying it all out smoothly, like we can think about it from Dr. Green's work as like there's a lagging skills deficit here coupled with the demands of the environment, and how it is that this gets solved. They're solving the problem, let's just say, of like, we're leaving the playground now, by like throwing a tantrum for the purposes of avoiding having to leave the playground, right? So that's not going to work longer term. So how is it we can address that? Well, being proactive about it and talking about how we can reinforce, this idea that like, I don't know, maybe we can get some schedule of reinforcement set up so that when we like adhere to the plan, we're rained all this positive attention and whatever else, all these kind of different kind of reinforcements. So the problem itself is like the transitioning, sure, but how it is that we address it is going to be a little bit best served by being proactive about it, and also, by communicating with your kid and developing a system that over trials they'd be able to transition a bit better. And I've even worked with families around like specifically leaving the playground, or things like that, where like we'll set up like a schedule by which they'll go to the playground with the intention of like the idea like, okay, we're going to leave, so they'll go play at the playground 5 days a week, and when they go to do it, they're talking to their kids ahead of time, and then over the course of trials, seeing how they can manage, both setting the expectation and then transitioning away from the playground as practice, so that when like the big moment hits, where they're at the, I don't know, birthday party and it's time to leave, it's not such a scene, so again, like it's a little bit more of a process. And other kids, I mean, for like just to kind of make note of the fact that like maybe peers of their kids struggling with this, is not much you can really do, about other parents and their kids, other than like I make a big point in the groups that I run to have like, empathy and compassion for other parents who you might spot struggling with things, and kind of give them a nod of like, hey, been there, done that, because like we have a tendency in the US to feel like we have to be perfect and our kids have to be perfect and everything has to be perfect. And so, when our kids are freaking out at Target, we're like, oh my God, like this is the worst thing that's ever happened to me. But yet every time I go to Target, I mean, every time I go to Target, I see a kid and a mom and some dysregulation, and I just kind of give a little nod. Like, been there, man, been there. So, I don't know about the peers, but
that's great. That's great. Thank you. This is specifically about helping a kid who we babysit on Mondays to move to like a scheduled event, and it's become more and more of a struggle to support him. So that's super tactical. Thank you.
Yeah. I think for a lot of those kids where it's like a repeated thing, really getting their attention ahead of time and talking about the schedule, and kind of getting them to understand it, because sometimes it can be a cognitive flexibility issue as well. It's like once they have it in their head, they're going to do this thing or whatever, and they're going to be there for a while. If we can talk to them about like, this is how it's going to go, and like I'm a huge proponent of getting kids to watch and helping them to understand time and how time works, because oftentimes these kids are just kind of in the dark and just thinking that they can just do whatever. Anyway, so it's a longer answer, as most of these are. Unfortunately, I wish it was simple. Thanks, Nadine.
Any other questions people want to ask? We have about 15 minutes.
If it turns out that nobody has any extra questions or whatever else, I'm happy to also just kick into gear for like another 15 minutes. I mean, be helpful to hear if that's what people actually want, or whether people want to just end or something.
I have one question.
Yeah.
Go ahead.
So I have two boys. They're both diagnosed with ADHD. One, emotional regulation, one, impulsivity. My older son has a humongous problem with feeling the need to be possessive or protective over things. And then the younger one, being impulsive, is constantly poking that tiger. So I don't know how to manage that. Or if anything in his house gets moved, it becomes a very big problem.
Got it. Yeah. It's a really tough one, Karen. Like like, so in a lot of the parenting stuff, or like whenever you're dealing with behavioral dysregulation stuff, and manuals and books and whatever else, it's like very limited around sibling relationships, specifically when they both have different issues. Because if you can think about it from the perspective of each kid, there's nothing particularly wrong with being possessive or kind of obsessive about your stuff. I mean, how many adults do I know that are like, oh no, that's my stuff. Like, don't touch my music collection, or don't touch, no, those are my like things, like, don't touch my things. Like, it's like, okay, well, touch your things, man, fine. Like, it's not a big deal. They care about their stuff. Like, by all means, it's not that huge a deal. How do you do that the right way? And how do you balance that in the context of your social relationships? Great question. Like, really tough endeavor to figure out. Then you got this younger one who's probably looking for some stimulation, wanting to develop a little bit of a relationship or have some fun with their older sibling. So they're poking the tiger in order to kind of get things to excite, like, look at this. And like, specifically with younger, I don't know if it's your youngest kid, but like the youngest kid in the family often is just like, hey, I have like no control. I'm the smallest. No one ever listens to me. I'm like the one that's like the least intelligent, the smallest, the least strong. Like, and so they love to like find some way to have control in the household. It's like, who could blame them, right? Like, they're just trying to, like, I don't know, get their kicks too, right? So pretty tough to figure out, but I think the goal would be, how is it that you can help your older child figure out how to manage this thing, this perceived sense or need that they have around, taking care of their things or whatever else, but doing so in like an appropriate way. What would that look like? And then from the younger kid's perspective, like, okay, you're bored, you're looking to have a good time, nothing wrong with any of those feelings. How do we deal with them? Do we like poke the older kid and like take their stuff? Because that just causes chaos. And so how do we, like, thinking about the two paths to reward there, Karen, how would you think about with the younger kid? What can you do with that feeling, and how can I help you and structure a way for you to like have fun? And like, I don't know, if you're feeling bored and you want to like have fun with your sibling, how can we do that the right way? And if they keep doing it the wrong way intentionally, as like a defiance or like an oppositional kind of behavioral pattern, just to annoy the older sibling, we can start to provide some semblance of consequences for that. I don't like being consequence driven when it comes to providing guidance or recommendations around kids and their disruptive behavioral patterns, but sometimes it's needed. Sometimes it's needed because it's so self-reinforcing. Hurting the older kid by taking their, I don't know, Matchbox cars and like chucking them across the room is aggressive. It's an aggressive action, and it's intended to hurt the older sibling. And if that continues to happen despite working with them and like providing them with all the skills and tools that they might need in order to like figure out how to deal with being bored, they're still doing it because it's so reinforcing, then we have to provide some semblance of consequence in order to help them establish that, like, oh, I can get my needs met this other way. It's less fun, it's less exciting, but I can get them met. And to kind of forge that pathway for that behavior, it can sometimes mean that we have to dole out some consequences. But that's like again, another like process. But like, I like hearing about like the idea that both of those kids are showing like almost like a strength. You know what I mean? Like, it's not necessarily a bad thing. Either one of them in and of themselves is not a bad thing. It's just how they're interacting that's causing a bit of trouble. And so that's how I would look at it. It's like, how can we get all their needs met the right way?
Yeah.
Does that help? Does that make sense? I don't know if
yeah. Thank you.
There's two more questions. So one is, what are the best ways to help kids' self-esteem when you see defensiveness settling in as a result of negative attention seeking?
It is the worst part of all this. When it starts to wear on their self-worth and their self-esteem, it's just, they label themselves almost as like a bad kid and then kind of lean into that narrative. It sucks. I'm holding in my mind like 4 stories of kids that this happened to, one of which is just harrowing. Loves your kid like crazy, a couple things that like we didn't get to are things like labeled praise. The idea that we, 5-to-1 positive negative interaction ratio, right? Like, force force positive interaction. When you see them doing anything that you think is positive or neutral, make it known that you like it, that you like what you're seeing. Say things like, oh my God, I love it when you X, Y, Z. Label the behavior that you're actually seeing that you like, instead of just saying like, oh, great job. Say like, hey, great job with this thing that you did. I really appreciated seeing you do it. Like, lay it on thick. One-on-one time is also like a huge way to kind of build rapport and trust and security within a relationship, which then when you say things like, you mean the world to me, they'll believe you. Because like when you're like laying it on, like, I don't know, judgment, criticism, because you kind of have to, because there's a lot of like disruptive behaviors going on, they don't believe you when you say like, oh, you're doing a great job, though. I love you so much. They're like, no, you don't. You know? It's so sad. It's like, that's the one that ripped my heart out the most. So that's like an everyday mindfulness practice around like, okay, how can I lift my kid up today kind of approach, which is really, it's hard to do when they're really struggling, but it gets easier with time. You continue to do it more and more, it kind of like snowballs. So do that often with your kids, man, because I'm telling you, like, if you read Taking Charge of ADHD by Russ Barkley, chapter 1, you know, is all about basically like, oh God, sorry, I'm gonna get verklempt. Parents feel like they're losing their kid. It's very, very sad. And it's like the most important work that any of you guys can do, to like lean into this and to try to learn as much as you can about taking care of your kids as they struggle with this, because it is so, so important. And it can be like this lovely, empowering, beautiful thing to, at the end of the day, be the parent that they needed.
Thank you.
All right, emotional.
The next question is again Nadine. She's preparing instructors to support kids with ADHD, and they need to speak with their parents about disruptive behaviors. What are some good framing questions or discussion tools to help the parents and not put them on the defense?
So if I'm to understand it, and Nadine, you can chime in, you're talking to parents about how kids are presenting at school and being disruptive?
Yeah, so we work with instructors during the summer, right, to go into classrooms, and a lot of the kids are neurodivergent or they have ADHD. And sometimes some of the tools that we try to prepare in advance aren't working. So the instructors go to the parents, and the best that I can think of is usually like, how do you see your kid as what makes him feel the most successful? Like, what tools do you use at home that make him feel good? Da, 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 da. But is there something better than that we can put on paper to say, here's how you start a conversation to make a parent feel included and at ease and supported and not defensive?
Right. A really good question. I think you're on the right track, but I think being really concrete would probably be helpful. And what I guess I mean by that is like, if these instructors, depending on like the level of engagement with that, like in other words, are they going to have like one-on-one meetings with these parents? Because if they are, you can be really concrete about like, what are the expectations that they're going to have in the classroom? Do the parents perceive this being a challenge for any of these kids, and how can they best support, you know, some of these kids' strengths as they come out? In almost in the same vein, like, what are some areas of relative weakness? And I think that that's a really nice way to frame most of the time what we're talking about, is like areas of relative strength versus areas of relative weakness, so that we can understand how to best support those weaknesses and highlight those strengths, because here's the expectations that we're going to have on these kids, and we want to see them all succeed. You know, like, that's probably the best I can give you off the cuff like this, but
that's great.
Yeah, so that's a good question. And I think it's also probably an important thing to make note of the fact that, like, you know, having consistency across contexts and environments is massive. I mean, I'll do a whole hour on like how to engage the school and talk to, you know, teachers or whoever and be an advocate for your kid and all these different systems that they're a part of, because just trusting that the system is going to be able to hold them is probably not always the best model. And being consistent with language across is so important. I mean, I have kids that I work with on my caseload where every week I meet with everyone involved, psychiatrist, therapeutic mentor, ABA staff, school adjustment counselor, parents, myself, and individual therapists, all on the same call every week, just to make sure that we're all using the same language and working together in the same direction, trying to push something forward. Those are obviously, extreme examples because some of these kids are really, 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 really struggling. But I think it's a good point to make that being consistent across home and school environments is big.
All right, thank you.
Yeah.
Anybody else? We have about 5 minutes. Dr. Brevik, you mentioned a couple books while you were talking. Are there any other suggested reads or websites you would recommend?
Yeah, there's there's a couple of good websites that people look to, and they're provided content by some of the best researchers and writers out there. But in all honesty, if the issue often I bump up against is that these books and these things, they're not fun, right? So you're not gonna love reading this stuff. So they're not page turners, and they're not always fun. You bring them on a vacation, you're not going to get through it. It's not that kind of deal. So I would suggest that like most of this stuff, mindfulness interventions or exercise programs or learning about this stuff, you gotta kind of force it. And if I was going to give you one, I referenced Taking Charge of ADHD by Russ Barkley, and the reason I reference it is because it's awesome. It's an awesome book, and it's all you're ever going to need. So if you want to look at, because he will reference all the different websites, whether it's Attitude or it's ADD, Etude, you can Google search that. There's Chad. There's a bunch of them, but he'll reference all of them in the book. So he'll give you all of those resources and more. And then also teach you how to understand research around ADHD so you can do your own, because ultimately you are in charge of your kid. And it's a massive responsibility. It's massive. So this one book, if you just read that one, I don't want to inundate people because it can rain down on folks, man. It's a lot. It's a lot of stuff to have to learn. Just get that one, or go get a provider that knows a lot about ADHD and work with, as often as you can. It's a process. It's long standing. I wish, the one thing I think that I don't like most about this work is the fact that we have a tendency to make people feel good by saying hey, we're going to do these interventions and then things are going to be all right. It's not the reality. The reality is ADHD is a long standing diagnosis. It doesn't go away. It doesn't evaporate. We're not going to make it disappear. And that's okay. Because if well managed, man, it's not that disruptive. I've met a lot of really successful people with ADHD. There's a ton of them out there. It's a pretty prevalent condition. It affects 5 to 8% of the population globally. So buckle up, buckle up. It's not going to be next week or next year that things are going to, I know that symptoms kind of go like this for a lot of families where everything's fine and they're oh, you know what? Maybe we'll just make it a big deal out of this. And then 6 months later, they're oh my God. And then so it's this you're gonna have to buckle up. It's a long haul. It's a long haul for sure. And so get your supports in there, get your system set up, learn everything you can about it, and be there for your kid, as you would with really any other disability. This is just an invisible and kind of annoying one sometimes. But read that book. That's all I can tell you. I think it's the best advice I can give you.
Thank you.
So my information Anjali, is going to be shared with folks. They can reach out to me if need be, like my email and phone number and whatever.
Shelby might be able to answer that one I don't know if that would be posted on the website.
Let me just say this for
Okay.
anybody who's interested in contacting me. I have a website. I jokingly named it this, but you know, it's drbrevik.com. And I say I jokingly named it that because, like, anybody who knows, like, drbrevik.com is a funny website. Anyway, so it's drbrevik.com. And if you just look up my name, Stephen Brevik, whatever, Amherst, my website will be on my Google profile or whatever. Just click on that. There's a web form there. There's my email. There's my phone number. You can text that phone number. You can, you know, whatever's the easiest way. If people want to get in touch with me, I'm not that hard to find. And so, you know, feel free, even if you just have a question after this, or like, I don't know, you're looking for a therapist for your cousin in 3 months and you're like, hey, you know, that Dr. Brevik guy said I could reach out. I mean it, like, reach out. I'm around. I can try to help whenever I can.
Thank you. Also let people know, I'm sure you've seen our flyers too about the ADHD's parent support group. So that is always available to anyone. If they're feeling stuck and they want to attend that, it's every month, I think the first Tuesday. And all you do is just, there's like a website, you could just go on there and register, and then you get the links. Well, we really appreciate tonight that everyone joined us, and thank you so much, Dr. Brevik, for this wonderful talk.
Anytime. Good luck, everybody.
Thank you. Have a good evening.